Our patients come in wanting something different. They're tired of just being told that they need another drug, they need another cortisone shot, they need surgery, or that's it. They're just gonna have to live with this pain for the rest of their life. So the exciting thing is that with this therapy, we've actually been able to see people heal and actually regenerate the parts of their body that don't work anymore, that are in constant inflammation and degeneration. We had a patient, she had had chronic knee pain for many years. She literally would cry every time she got out of bed. And after a couple days of receiving stem cells, she was able to get out of bed for the first time in many, many years. And that is only the beginning.
The type of stem cells that we use are umbilical stem cells. We get these from a healthy baby and a healthy mother. The tissue bank will make sure that everything is clean, sterile, there's no type of diseases or anything like that. And then we actually have a third-party company that comes in to make sure that all of these cells are live and to make sure that they are all viable. And what they do is they ship it to us on dry ice because it's frozen in their lab at -60 degrees, and we keep it frozen until it's time for the person to use. And then what we do is if we do it into a joint, we will do it into their knee, hip, shoulder, wrist. Sometimes people do it intravenously, but what they do is these stem cells will actually start to become tissue. They start to seek out inflammation. They start to seek out damaged tissues, and they can start to become meniscus, and it actually starts to rebuild that. For about 90 days, you are going to be continually getting new cells, which start to rebuild the damaged areas in your spine, shoulder, hip, knee. In our research, umbilical cells are the best type of stem cells. And then also look for the price. I like to talk about stem cells, not necessarily as a cost, but more as an investment in their health. But the fact is that our stem cells, if you really do the research, our stem cells are much more affordable than any other stem cell company around here. A lot of people, they've heard a lot of controversy in the past with the fetal stem cells, which number one is highly unethical for me, and second, it's illegal here in the United States. So that's what you've heard on the news for the last 10, 15, even 20 years is it's all with the fetal. But number one, we would never ever in a million years do that in our office, and number two, it's highly illegal, so we'd never be able to do that anyway. We try to give people as much information as they can get. That's why we do a lot of workshops. So we do workshops all the time because we find that a highly educated person makes the best decisions as far as their health is concerned. What I would recommend is that you watch our webinar that we have in here, or come to one of our other workshops, because we will go into detail on who the candidates are, who they are, and then we'll sit down with you and we'll talk with you and see if you are a candidate.